Common cold, as you know, is a very common ailment. Back pain is second common ailment after back pain. So you can imagine how frequent is back pain amongst people. It is the second most common ailment globally. 80 to 85% of people will suffer a significant low back pain problem at some point of their lives. Nearly 70% of them will have a recurrence within 1 year of the initial episode. It is responsible for the highest number of man-hours lost in the industry in US. So if we were to look at the global burden of low back pain, it causes an estimated loss of 800,000 disability-adjusted life years globally every year. These are as per published statistics. Economic burden of back pain is estimated to be between 1% to 2% of the gross national product in Western nations. It is calculated at more than $100 billion annually in the US. The back pain has a peak incidence between the age of 20 and 50. So the young active people are the ones who are most involved, and this further adds to the consequences of back pain. 75% of the Indian population reported lifetime prevalence of low back pain. There is a high prevalence of low back pain in subjects aged 20 years and above. Even in this population, up to 41% will have a prevalence of low back pain. This prevalence was significantly higher among women compared with men, that is 52.9% as compared to 28.4% respectively. Low back pain constituted 37% of all occupational risk factors and ranked first among the disease complications caused by work in India. The prevalence of low back pain in construction workers has been found to be 92%. So, with the pandemic, we know that the COVID pandemic has had a huge impact on all of us. There has been a significant increase in the number of complaints of back pain during the pandemic compared to the immediate pre-pandemic period, and this has been up to 84%. Another statistic which showed the increase of back pain during the quarantine by a substantial percentage. In India, the prevalence and incidence of low back pain in workers increased from 1.4% to 20%, and neck pain from 0.024% to 7% respectively as compared to pre-pandemic times. The consequences on the individual are variable. They may vary from the very mild to the very sinister. Let's look at some case scenarios, right? This is the example of a 28-year marketing professional, had low back pain since 4 days, started after a sudden jerk while exercising. She visited a doctor, was prescribed anti-inflammatories, hot fermentation and local gel. The pain subsided and she's back to her active and healthy lifestyle. So this is the general scenario of low back pain, where most of them would resolve and are mild in intensity. But not everybody is lucky. There are a few where there can be sinister consequences. Like this 29-year software professional working from home during the pandemic, had mild low back pain off and on since 9 months, and had an exacerbation since 3 days, was prescribed anti-inflammatories, and the pain subsided. However, the back pain recurred after 21 days, was again prescribed anti-inflammatories and rest for 2 weeks. The pain subsided. The back pain again recurred after 9 weeks. The individual went to another doctor, was prescribed an injection in the back. The pain subsided. However, the back pain has continued to bother him significantly for the last 11 months. He has been forced to be off work for 32 days, during which he took bed rest. He has tried naturopathy, homeopathy, Ayurveda, faith healing. He's very stressed because his job is at stake. This often makes us wonder what went wrong. Let's look at another 72-year diabetic lady's scenario. The mid back pain had been there since a fall 4 months ago. She visited a local general practitioner and responded temporarily to treatment. An X-ray was prescribed by a second doctor, which revealed a fracture of the vertebra in mid-back. Was prescribed bed rest for 6 weeks. She started ambulating 10 days ago. Since 4 days, she had started developing weakness in the legs. She couldn't take weight on the legs and had to strain to empty bladder since 1 day. She was evaluated by the doctor today and advised surgery since the osteoporotic compression fracture was causing pressure on the spinal cord and resulting in progressive increase in symptoms, which were mainly weakness and bladder symptoms. Now, this is a 14-year girl's case scenario. She has developed a hunchback which has been gradually increasing over the last 2 years. Parents had taken her to a doctor today who had got an X-ray done and diagnosed her as having a kyphotic deformity. A detailed history was taken by doctor, which revealed that the girl was treated for lung tuberculosis 3 weeks ago. Along with fever and cough, she had developed severe back pain, which subsided over 3 weeks of treatment with anti-inflammatories. The doctor has advised her surgery since he feels that the deformity is beyond acceptable limits and would progress with time. If not corrected, it would not only be cosmetically unacceptable, it could result in gradual weakness in legs and paralysis. Another 36-year-old male has been suffering from back pain since the last 7 years. Pain is diffuse over the whole back and is the worst with associated back stiffness when he wakes up in the morning. Over time, he has gradually got a bit bent over and has not been able to sit cross-legged. Since the last 2 weeks, his sleep gets interrupted in the very early hours of the morning due to severe pain. 2 days ago, he visited a doctor who diagnosed him as suffering from ankylosing spondylitis, which is an inflammatory disease. He has been advised general conditioning and stretching exercises as well as a proper posture. He has also been referred to a rheumatologist for further evaluation and initiation of disease-modifying drugs. The last case scenario is of a 66-year-old male who has been suffering from back pain since the last 6 weeks. Pain was initially worse at night, but has gradually increased such that it bothers throughout the day. His appetite had reduced and his clothes have loosened, suggesting that he has gradually lost weight. The doctor he went to 3 days ago got an MRI done. He had some suspicion and so advised a PET, which revealed a lesion in lung as well. They suspect a cancer of lung has spread to the spine. A biopsy was taken from the lung yesterday. So friends, you have seen that back pain, the consequences can vary from the very mild which resolve, but some of them can be very sinister, and we should be aware about the red flags or the warning signs when we need to take the back pain seriously and when we need to meet our doctor and have the back pain evaluated. So this is what I thought would be the overview of the presentation. We have discussed about the prevalence and impact, and we have shared some case studies. We will be covering in the rest of the presentation the anatomy of the spine, the causes of low back pain, predisposing factors, natural history of back pain, Approach to a case of low back pain, non-pharmacological, pharmacological and surgical management, myths regarding the low back pain, and at the end we will have a carry-home message for all of us. So for those who may not be aware with the anatomy of the spine, there are 33 vertebrae in the vertebral column or the backbone. There are 7 in the neck or the cervical region. There are 12 in the upper back or the thoracic region. There are 5 in the lower back or the lumbar region. And there are 9 sacrococcygeal fused vertebrae in the sacrum and the coccyx. The coccyx represents what you would call as the tailbone. It's the remnant of the tail in the primates or the other animals. So if you look, each vertebra is stacked over the other vertebra. In front, there is a solid portion called the body of the vertebra. And behind, there is a ring-shaped bone which encloses a canal where the spinal cord comes down. Behind, there are a couple of joints between each vertebra and the lower vertebra, and a couple of joints between that vertebra and the upper vertebra. In front, there is the intervertebral disc, which acts like a shock absorber, and it is there between 2 vertebrae per se. So, the backbone, if you look at it from the front, may be absolutely straight, an erect spine. But if we look at it from the side, it has curves within it. In the neck, there is a curve forward, which is called as the cervical lordosis. In the upper back, there is a curve backwards, which we call as the thoracic kyphosis. In the lower back, there is a curve forward, which we call as the lumbar lordosis. And then there is a sacral kyphosis. In a normal posture, these curves need to be maintained. But if we are in a bad posture, these curves get stretched, and that is what puts a lot of stretch on the ligaments and the muscles and may predispose to back pain, as we will discuss about subsequently. So we talked about the protected passageway in the spine, in which the spinal cord comes down, protected, and at the level of each vertebra, 2 nerves come out and supply a respective part of the body. For example, in the neck, or we talked about that as the cervical region, the nerves come out and supply the upper limbs or the arm and the forearm and the hand. In the lower back or the lumbar vertebra, the nerves come out and supply the lower limbs or the thighs and the legs and the feet. Each nerve supplies a particular area of the body. And friends, it is not only movement and sensation that these nerves coordinate, they also coordinate various autonomic functions like bowel and bladder control and sexual functions. And these are important, as we will discuss subsequently as well. So it is important that the spine moves down, the spinal cord moves down in this protected passageway. The spinal cord ends at the level of generally the first lumbar vertebra, and below that it is generally a bundle of nerves which continue moving down and exit at each level per se. The spinal musculature, as you can see here, is also very important. As you know, man once used to walk on 4 legs like the animals, but gradually assumed an upright posture. And this upright posture puts the back to a biomechanical disadvantage, since the weight of the upper body passes through the back now rather than through the 4 limbs, as when he used to walk on 4 limbs. The strong back muscles support the spine, and if these muscles become weak, they predispose to back pain. Now, there are various causes of back pain, right? There can be spondylogenic back pain, which could be mechanical, like discogenic back pain, facet joint pain, Soft tissue lesions like ligament strain, muscle sprain, traumatic fractures, sacroiliac joint pain, or non-mechanical pain like inflammatory pain, the ankylosing spondylitis that we talked about, infection, the tubercular lesion that we talked about in the young girl, tumor, as we talked about in that 66-year-old male, metabolic, we discussed about osteoporosis in that elderly female. So there can be neurogenic back pain also, which could be due to irritation of the covering of the nerves. There could be viscerogenic back pain due to abdominal and pelvic viscera. There could be vascular back pain, and there can be psychogenic back pain. Let's discuss them a bit further. The mechanical causes are the most common cause of back pain, and they are simply like when you twist your ankle, you get a sprain there. Similarly, if the joints of the back get twisted, you can have a sprain, or if the muscles get strained, you can have back pain, and this is vastly responsible for the most common causes of back pain. Sometimes the disc which we talked about between two vertebrae can slip backward, as you can see in the MRI and the graphics here, and this can irritate the nerve, as you can see coming out from the spinal cord at that level, and then the pain would travel down along the distribution of the nerve. So we talked about the nerve coming out from the neck and going to the upper limb and the arm and the hand, and from the lumbar region going down into the leg. So the pain may travel accordingly from the neck up to the upper limb, up to the hand, or from the back up to the lower limbs or into the leg. And friends, we talked about each nerve supplying one respective portion of the body, and thus the pain, by knowing where the pain travels, you can find out which nerve is getting irritated. Amongst the mechanical causes are also spondylitis. These are due to the normal aging changes that take place, like you get the arthritis of the knee joint. Similarly, changes take place in the disc and in the facet joints, and this can result in spondylitis, and that can also cause pain. Lumbar canal stenosis is a condition where, due to these degenerative changes, the joints become thicker, hypertrophied, they encroach upon the canal, the central canal, and the nerve foramen from which the nerve comes out at each respective part of the vertebral body, and they start irritating the nerve roots. So in these people, the pain is typical. The pain would travel down the leg. As the person would walk, the pain would gradually build up, and after a certain period, the pain becomes so intense that the individual needs to sit. And once the individual sits for a while or stands for a while, the pain subsides, and the individual could walk for the same distance again, and then would need to sit down. Over time, as the degeneration increases, the distance that the individual can walk becomes smaller and smaller, and ultimately the person can walk only a few meters and sometimes get confined to the bed as well. Now there's another condition called spondylolisthesis. Here, the joint between one vertebra and the lower vertebra gets affected, as you can see here. So there's a break in the bone which goes on to form the joint, and because of this, the joint is not functional. So one vertebra starts slipping forward over the other vertebra, and as it slips, there is back pain because of the instability, because of the vertebral movement, and also there can be leg pain because of the irritation of the nerve as the foramen and the canal gets narrower because of the slip forward of the vertebral body. We talked about inflammatory causes, ankylosing spondylitis, rheumatoid arthritis, seronegative spondyloarthropathies. The typical symptom in these patients is that the pain will be worse after rest. In a mechanical pain, the pain is worse after exercise, after exertion. Just contradicting to that, in an inflammatory cause, the pain will be worst in the morning as the person gets up. So after rest, or even during the day, if the person rests for a while and then gets up, will have stiffness and pain. And with time, as the disease progresses, the stiffness and the pain increases. This is generally due to some antibodies being formed within the body, wherein the joints of the spine and the one between the spine and the pelvis and the large joints of the body like the hip, the shoulder getting affected, and inflammatory pain starts bothering these patients. In rheumatoid arthritis, it's generally the small joints, but in ankylosing spondylitis, it's the large joints like the spine which gets affected. Amongst the metabolic causes are osteoporosis. What is osteoporosis? It's generalized reduction in bone mass and bone quality. So the bones become weak. You can see that there is a framework of the bone. Throughout the life, the bone forms and the bone breaks down. But when the rate of bone resorption exceeds the rate of bone formation, the bones become weak. So in females, the female sex hormone is responsible also for the bone metabolism. And so after menopause, when these hormones subside, the breakdown increases and that leads to gradual weakening of the bone. So if in females, if there is an early menopause due to any reason, the bone becomes weaker faster and at an earlier age than the corresponding females in whom the menopause takes place at the normal timing. We talked about tuberculosis of the spine. There can be also fungal infections in the spine. There can be bacterial infections, what we call as the pyogenic spine infections. And then tumors, there can be primary tumors of the spine. There can be metastasis from known or unknown primaries. There can be other tumors of the spine which may be benign or which may be cancerous or malignant. Now, there are some predisposing factors which predispose individuals to back pain. And amongst the most common ones are sedentary lifestyle. Due to the sedentary lifestyle, the muscles become weak. Imagine the lifestyle of all of us 7 to 8 decades ago, when men would work on the fields, walk back home, they would look after animals. Women would work in the fields, go to the well, they would look after animals, grind the floor, wash utensils, wash clothes, do household work. So there was a lot of general conditioning exercises in day-to-day lifestyle, and the muscles would stay strong. Compared to that, look at the modern day lifestyles, which is more or less sedentary. If you do not add general conditioning exercises to this lifestyle, the muscles become weak. They do not support the spine well, and this leads to back pain per se. On top of that, in the modern day lifestyles, bad postures have become very common. Whether it is working on the laptop, watching television, sitting on the sofa, on the workstation, lying down on the bed to watch TV or reading. So there are bad postures which strains the spinal muscles. They obliterate the normal spinal curvature, as you can see here, and the strain on the ligaments and the joints leads to back pain. And now I would want to let you know here that due to bad postures and sedentary lifestyles, the back pain had spread like an epidemic in the modern era. And lo came the pandemic, the COVID pandemic, and because generally people were confined to home, they were confined to working from home, and they could not take part in the general conditioning exercises they may have been doing before, and the work environment at home is for leisure and not for professional work. So the postures became bad, and that is the precise reason why back pain pandemic has spread along with the COVID pandemic. Now, if people become obese, the center of gravity starts moving forward, and also more weight starts loading on the spine. And because of both, there is more stress on the spine, and this also predisposes to the back pain. Would want to add here that during pregnancy, similarly, the muscles get bloated, the center of gravity shifts forward, and after delivery, the muscles become flabby, and it is important to tone up the muscles of the back so that they can support the spine properly. Due to these very reasons, back pain during pregnancy is quite common if females do not engage in general conditioning exercises throughout the pregnancy, and if they do not tone up the muscles after delivery, that becomes the seed of back pain. Since the foundation of the spine becomes weak, even a minor stress or strain may lead to back pain subsequently. And this we discussed as amongst one of the most common causes why females in India become predisposed to back pain and may be having a much higher incidence of back pain than the males. Now, pain is a very complex phenomenon. It is not only one stimulus in the spine which leads to back pain. If you have any stimulus anywhere in the body, the pain gets compounded and the intensity increases. So similarly, if one is stressed, it lowers the threshold to withstand pain, and pain anywhere in the body becomes more intense. And this would be especially applicable to back pain, which is amongst the most common pain that we can have. And any stressful lifestyle can predispose to back pain and neck pain. Coming to the natural history of back pain, it is extremely variable. Some patients are better within days. Others complain of back pain for years. There's a remarkable variation in the severity of pain, and dysfunction occurs between patients with comparable lesion and within the same patient over time. Most episodes of back pain, as we talked about before, will last only a short time. Up to 75% will recover in 3 months. Nearly 70% of these sufferers will have a recurrence within 1 year of their initial episode. So, an approach to a patient of back pain, what do we normally do? It is very important to determine the cause of back pain through a good history, through a good examination, and through a diagnostic evaluation. So, from a history, we obtain a targeted one to identify red flags, which are possible indicators of serious spinal pathology, or the yellow flags, which may be psychosocial factors which are shown to be indicative of long-term chronicity and disability. So amongst the red flags are extremes of age, minor trauma, age of onset less than 20 years or more than 50 years, significant trauma in the young people, unexplained fever due to any cause, any infection in the body, or this could be leading to also back pain if it seats in the spine, progressive or disabling neurological deficit, perennial numbness, or bilateral leg weakness, or difficulty in passing urine, or difficulty in controlling the bowel. A history or strong suspicion of cancer is another red flag. Unexplained weight loss, chronic steroid use, immunosuppression due to various diseases or even steroid use, intravenous drug abuse along with back pain, lack of improvement after 6 weeks of conservative therapy, or in pain in the upper back, because normally pain is more common in the lower back where much of the movement of the body takes place. Ill health or presence of other medical illnesses along with back pain. These are all red flags. And amongst the yellow flags are affective disorders like depression, irritability, anxiety, behavior problems like poor coping skills, impaired or excessive sleep, dramatically reduced activities of daily living, passive attitude about and poor compliance with rehabilitation, social withdrawal, increased use of alcohol or other substance abuse, belief like catastrophic thinking, belief that pain is uncontrollable, physically harmful, may be completely eliminated before returning to work, misinterpretation or exaggeration of other somatic symptoms, expectations of a technological solution for back pain. There can be occupational yellow flags like expectation of worsening pain or setbacks with activity, or a poor job satisfaction, problems with claims and compensations, and pending litigations. So one would do a physical examination to note vital signs and the entire systems of the body to try to identify non-mechanical and visceral causes of low back pain. Then one would try to localize the pain with examination by inspection of the part, by palpating it, and a radiation of pain should be noted along with any deformity which may be there, which may be suggestive of degenerative disease or osteoporotic factors. Neurological examination is important because we have to rule out the red flags through that, and findings consistent with cauda equina syndrome, where one tends to lose bowel and bladder control, require immediate attention. We talked about all these symptoms when we talked about the red flags. Due to high prevalence of low back pain, as we discussed, and the self-limited nature of most episodes, the clinician is obliged to be judicious with regard to diagnostic testing. So we do not always go in for evaluation. Lab tests are of limited utility and focused on identification of visceral and non-mechanical diseases suggested by red flags. In the absence of red flags, diagnostic imaging is not warranted unless 4 to 6 weeks of conservative management has failed to achieve improvement. And we can have various radiological evaluations. X-ray is low cost and easily available, but minimally useful in soft tissue evaluation. CT scan detects the bony injury better, whereas MRI looks at the soft tissue in greater detail. And you can take various sections of the spine, whether from one side to the other, from front to back, or from side to side, and you can see in the axial sections where the disc is bulging, whether the canal is narrow, whether the nerve is getting compressed. And so this is a method of choice for detecting, for evaluating spine which is not responding well, and for detecting sinister problems like malignancy and infection. So it provides a better visualization of the intrathecal nerve roots and of any nerve involvement which may be there. Now, we talked about osteoporosis, poor bone mass, weak bones. This can be detected well with a DEXA scan. And if there are high-risk factors for osteoporosis, we would generally get a DEXA scan done to find out if there is osteoporosis or osteopenia, which is not critical weakness. Now, there are other tests available like a bone scan or a PET scan, which is like a whole-bodied CT scan, where we would want to evaluate for special indications like suspicion of cancer or malignancy. Now, it is very important when we talked about evaluation and especially radiological evaluation that there needs to be clinico-radiological correlation. In elderly people, there will be normal degenerative changes, and if you get the MRI of all individuals above a certain age, there will be various MRI changes which could be seen. Even in younger individuals, say in a 35 to 40-year-old, if you take MRI scans of 100 people who have no symptoms, 30 to 40% of them will show changes, and one should always correlate clinically any radiological findings. So asymptomatic patients don't need to be treated unless you find any sinister findings on the radiological evaluation. How do you treat back pain? One would treat back pain by treating the pain, but it is also very important to try to remove the cause. And one should try to reduce the recurrence rate. We talked that up to 70% of people would be prone to a recurrence. And unless you take care of recurrence or reduce the chances of recurrence, we have not managed back pain properly. Another very important thing to understand is that 95 to 97% of patients with back pain will respond to a good conservative treatment and will not need a surgery. Now, previously, it was often told if you have back pain, go in for bed rest. There is no evidence of benefit of bed rest for low back pain. In fact, bed rest can be counterproductive in that it increases the chance of pain becoming chronic. Early return to normal activities within the limits of back pain tolerance is associated with more rapid recovery. When we talk about treatment, there can be proven treatments and unproven treatments. Proven treatments are something that will change the natural course of the disease, and unproven are those which provide some temporary relief but do not change the natural course of disease. Amongst the unproven treatments are spinal manipulation, which is safe in the hands of an experienced practitioner, and benefit appears to be independent of the specific discipline of the provider, but should not be done by untrained individuals per se. Massage is an unproven treatment when there is evidence of efficacy, is better for subacute and chronic pain. Hot or ice packs provide short-term relief in both acute and chronic low back pain. Some may benefit with hot packs, some may benefit with ice packs. In general, during the initial 24 to 48 hours of the episode of an acute back pain, ice packs do better, and after that, hot packs do better, but you can't generalize this. By trial and error, you need to see what suits you better. One can take in deep heat therapy at a physiotherapy center, which provides short-term relief in both acute and chronic low back pain. When there is leg pain, TENS is a good option which is available with the therapist. Traction is an unproven treatment. It does not appear to be useful for back pain, regardless of the presence of sciatica. Many people use it, but if you benefit from it, you could try it out, but you should remember that sometimes the pain tends to get aggravated with traction, and you should stop it immediately if the back pain is bothering you. Corsets provide temporary use if it improves mobility. So very often the question is asked, should we use corsets? If they help you during the acute phase in moving around better, in doing more activities of daily living, you could use it. In some people, the pain may increase, so they need not use it. In others, also where they do not have any difference whether they use the corset or not, they also need not use the corset. Acupuncture and acupressure again is an unproven treatment, but it does tend to provide relief in a large number of people. Pharmacotherapy, there are various agents like acetaminophen and NSAIDs, muscle relaxants, tramadol, opiates, and pregabalin. But a word of caution is that you should, those with liver diseases or renal failure should not take it without a prescription. Even otherwise, you should not take it for a long duration because it can have harmful effects. Epidural steroids, if conservative treatment fails, 60% get long-term relief with 3 transforaminal selective nerve root epidural steroid injections. They tend to remove the inflammation from the nerve and thus tend to give relief. The very important proven treatment is patient education. We talked about the recurrences of back pain, and like common cold, it can bother you off and on. So learning about how to remove the causes of back pain, having a healthy lifestyle, etc., helps the patients to reduce the chances of recurrence and in fact prevent the incidence of back pain. And this is a proven treatment for back pain, along with aerobic physical conditioning exercises. Aerobic physical conditioning exercises are those which strengthen the muscles, improve the posture, and strengthen the bone. So there are 3 types of exercises, and we will discuss them one by one. The aerobic exercises increase the consumption of oxygen of the muscles. They are the most important exercise to help back pain as per research. And examples are walking, stationary cycling, roadway cycling, swimming, and stair climbing. Stretching exercises have not been shown by research to always help, but when you do it, and if any particular movement increases your pain, please avoid that movement. And if you have special problems like cardiac ailments or joint pains, always seek professional help before you engage yourself with exercises, and especially those which increase your pain. In some cases, stretching exercises, as we talked about, may make the pain worse. So that's why it should be started with professional help, especially if it increases back pain. Resistive exercises are more commonly called weightlifting. They strengthen the endurance muscles and should be performed with proper dosage of weight. These have not been shown to improve back pain or the chances of recurrence. So back pain management involves a multidisciplinary management. There should be a positive reinforcement of healthy behaviors and consequent withdrawal of attention towards pain behaviors. Cognitive treatment aims to identify and modify patients' cognitions regarding their pain and disability. And this becomes especially important once the pain becomes chronic or lasts more than 3 months. Behavioral techniques are often applied together as part of a comprehensive treatment approach. So a psychologist is very important very important component of the team which manages back pain, and the spine clinician often takes their help in patients where they feel this would improve the outcome. Amongst the other proven treatments is surgery, but as we discussed, only 1 to 3% of back pain sufferers require surgery. And we would go in for a surgery only if adequate conservative management fails, except in conditions where there are red flags, where you may need to go in straight for a surgery, like we talked about bowel and bladder involvement and other problems. So the first line of treatment is always conservative, and we go in for surgical management if it fails. There's virtually no role for surgery in patients with non-specific low back pain. Most patients displaying radiculopathy will also improve without surgery. In the presence of fracture, infection, progressive deformity, or spondylolisthesis, as we talked about, deformities leading to instability, there is supportive evidence for spine surgery if they do not respond to a conservative treatment. Again, in surgery, it is important that we treat the cause. So depending on the cause, we may need to go in accordingly for management. And in a case of prolapsed intervertebral disc, you may need to remove the disc in 5% of cases which do not respond to conservative treatment. And this can be done by classical techniques or by a limited incision under a microscopy, or you can do it minimally using minimally invasive techniques, what we call as a keyhole surgery. As you see here, after dilatation of the muscles, a tubular retractor can be put in where you can put in a camera and a light source, or an expandable retractor may be put in and you can do the surgery. The principles of surgery remain the same. How you approach within is different. Here in minimally invasive techniques, you only dilate the muscles by a limited, very small skin incision, and this helps in post-operative rehabilitation because the muscles are not split. Post-op pain is less, muscle strength is retained, and patients return back to work faster. So similarly, even if we need to fix the spine, there are minimally invasive options, as you can see here, where you can put in screws percutaneously or through an expandable retractor, as shown in these graphics. Robo has a navigation component and a robo component. So you can see that it combines both the robotic technology with the navigation technology. The robotic arm, as you can see here, beauty of this robo is that you have it strongly interfaced with the patient so that they act as one unit. The arm image, then that becomes evident here, and you can plan the surgery on the robo. Once you have attached the robo to the patient, you need to define a safe area in which the robotic arm can move. With the O-arm, you take the images as the patient is positioned, so you are more accurate. So use of O-arm, which is like an intraoperative CT scan, and robotic technology helps to make spine surgery safe. It adds precision wherever fixation is required. Now, amongst the modern techniques are also alternative techniques to fixation, like you can do an artificial disc replacement, but these are more often used in the cervical spine. Then in the low back, you can have dynamic stabilization devices, which are interspinous or pedicle based devices which can be used. Now, if in osteoporosis, the collapse of the vertebra, that is like a fracture which takes place in an osteoporotic spine, does not respond to a good conservative treatment. Mind you, it responds most often on the time, and only 1 to 3% would not respond. You can inject cement into the vertebral body. You may inject it directly through the vertebra, but here there are chances of cement leakage. If you insert a balloon and create a space for the cement to be put in, you can then inject the cement into the space, and the chances of local or distal leakage of the cement become substantially minimized and the complication rate reduces. Now we talked about trying to reduce the recurrence rate of back pain. For that, it is very important to remove the predisposing factors. So you may need to do general physical conditioning exercises for this, or specific back exercises, and follow proper posture in everyday activities, and control any interfering psychosocial, professional, or personal emotional factors. Now, we would discuss about the myths of back pain at the end. One of the myths of back pain is stay in bed. And as we talked about, bed rest only weakens the muscle further. It also weakens the bone, and there are more chances of the pain becoming chronic once you mobilize yourself subsequently. So it is just a myth that back pain gets helped with bed rest. So we would generally advise that the patient should move around as much within the limits of pain, And very rarely do you need them to be on the bed for 1 to 2 days if the pain is very severe, and that too should be managed aggressively. One of the other myths is that you need prescription drugs to bring relief. Except if there are red flags, you could manage the back pain yourself with non-prescription drugs and with other aspects of back pain management like fomentation, gel, or therapy. And you may need to see the doctor only if you are not responding to the conservative treatment, or if there are red flags. Again, a myth is stay away from surgery. It has poor results and high complication rate. So if a surgery is indicated, then the chances of complications are far more without the surgery than with the surgery. With advanced technologies, spine surgery has become very safe and can be safely done where indicated. But again, reinforcing that most of the patients would respond to a good conservative treatment per se. Other myths of back pain: don't exert yourself. You should have restricted activities for life. You can never get back to a normal lifestyle. So these are all myths. People have got back to a normal lifestyle, have played international level sports after major back surgeries, and with the advancement of spine technology, you should not be limited in any manner in either activities of daily living or in whatever passion you have regarding sports or adventure per se. So if we were to look into what went wrong with that 29-year software professional where back pain recurred again and again despite him going to doctors and taking spinal injections. Friends, the pain was treated, but the causes and predisposing factors, we discussed about the causes being sedentary lifestyle, bad posture, stressful lifestyle. These were overlooked and was prescribed prolonged bed rest. So friends, it is important not only to treat the pain, which is a symptom. It is very important to treat the cause where it is there and also to remove any predisposing factors if we need to have good results of back pain management. So the carry-home message, friends, would be that back pain is the second most common ailment, second only to common cold, and it is very prevalent. So don't be afraid about it. There are lots of people who have back pain across the globe. 8 out of 10 people will suffer from a significant episode at some point of their lifetime. Sedentary lifestyles and bad postures have been responsible for back pain reaching epidemic proportions, and now with the COVID pandemic proportions. And if we need to have a good back pain management, if we need to reduce the chances of recurrence, we need to take care of the predisposing factors. 75% of sufferers will improve by themselves within 3 months. One should treat not only the pain, but also the cause and try to address any predisposing factors. Only 1 to 3% of back problems ever require surgery. Proper lifestyle, including general conditioning exercises and proper postures, help. Friends, we talked about one of the most common ailments which can affect mankind, that is back pain. And this webinar was brought to you as part of the webinar series of the Spine Wellness and Care Foundation. You have the website of the foundation mentioned here. Please log on to the website and give your views about the work that this foundation does. We are also available on Facebook, YouTube, and Instagram. The Spine Wellness and Care Foundation is a charitable non-governmental organization established for improving the wellness of people with spinal ailments in India. We reach and serve persons affected with spine-related ailments medically and socially to help them lead better lives. Our main objective is to provide medical, rehabilitational, vocational, recreational, and social support for persons affected with spine and related ailments. The instructional videos on back pain management, especially friends, are available on the website of the foundation and also on the website of Spine Wellness Expert. So you could always log on to these websites and know more about back pain, know more about the exercises that can be done in back pain, know more about a good posture, know more about general principles of management of back pain through these websites. But friends, this program will also be available live to you on Facebook and subsequently on YouTube. So you can always come back later and know more about back pain or try to reinforce what you have, the knowledge that you have gained during this webinar. And of course, if you have any queries, you could always write to us. We will also respond to the queries that you post in the chat box today after this session. Friends, we have a series of webinars, and the next of the webinar series of the Spine Wellness and Care Foundation would be specific for spinal cord injured, bladder management of spinal cord injuries, challenges and opportunities. And we have a very famous neuro-urologist, Dr. Dinesh Suman, and two very renowned and famous consumer friends and part of the Spinal Foundation, Dr. Komal Kamra and Shivjit Raghav, who will be joining us for this webinar. And of course, for the benefit of our friends who are more familiar to Hindi, Peet Dard Se Hain Pareshan will be the webinar which our friends can listen to on 26 November. So दोस्तों, आप में से जो हिंदी से ज़्यादा familiar हैं, आप कृपया 26 नवंबर को 7 बजे इस पूरे वेबिनार के बारे सुन सकते हैं और स्लाइड्स भी हिंदी में होंगी और हम वार्तालाप भी हिंदी में करेंगे और आपके सवालों का जवाब भी हम हिंदी में देंगे. So friends, it is in our hands to create a better world for all who live in it. Come, join hands to improve spine wellness and care and to alleviate the burden of spine disease. Thank you. Thank you for your patience. Thank you for logging on today. And I'm sure you will all share the knowledge that you may have gained today or that you are aware about amongst all your friends, because we discussed today a very common ailment which is second only to common cold in prevalence. So thank you, friends, and I'll be happy to answer to any questions which may be there in the chat box right now.